Hello, I'm Greg Jamian, and thank you for watching Boomer Health at Home, the show where we explore the most relevant healthcare topics impacting the baby boomer generation today. As more and more baby boomers seek answers to many times difficult healthcare questions, our goal is to provide ideas, tips, and cutting-edge solutions that will help improve your everyday life and health. It is our hope that you find the following information helpful as you sit back and watch Boomer Health at Home.
Hello and welcome to Boomer Health. I'm Maggie and Director of Nursing at AmeriStaff Nursing Services. Today I'm joined with Megan Clinical Nurse Supervisor of AmeriStaff Nursing Services. Today we're going to talk about heart issues, mostly cardiac issues. So Megan, there's been a lot of talk about heart attacks around this time of year. Mm-hmm. What is a heart attack?
So you have to think of the heart with a bunch of pipes all across the front of it, back of it, around it. Those pipes are what makes the blood flow to your heart, brings oxygen to the heart. When they get slightly clogged or they actually clog all the way off, that's when you get a heart attack because now the oxygen can't get to the cardiac muscle.
Oh, okay, very interesting. So what are some signs of a heart attack? I've heard they can be different for men and women. What's all that about?
They can be. Men, it's a pretty classic, elephant sitting on the chest, tons of chest pain, discomfort, can radiate down their arm, usually on the left-hand side, up the jaw, sometimes into the back. They have a little bit of shortness of breath, nausea, dizziness, might feel like they're sweating a bunch. And usually men are triggered by physical activity. So they'll be out shoveling snow when they haven't done any physical activity the rest of the year. They go out, shovel snow, all of a sudden it hits. Sometimes it'll come and go, like back and forth. For women, we have it a little bit harder, of course. So a lot of times it's indigestion. It's this epigastric stomach pain. Sometimes it'll go up into the jaw, into the back. A lot of times it's anxiety, fatigue, tiredness, flu-like symptoms, being pale. So it's a little hard to see in women. Okay. Sometimes they'll have the classic symptoms, and a lot of times it's brought on by emotional stress. So this beautiful holiday that's coming up, and it's not stressful at all. Have your house clean and bake everything and have everything perfect. So a lot of women, it's the emotional stress that brings on the heart attack.
Okay, and then so with a lot of women, when you said epigastric pain, are you talking about like heartburn?
Yeah,
in a
sometimes.
Sense? Is that what the feeling is?
Yes.
Okay.
Yep, like a heartburn type pain.
Okay. I just hear that a lot, like a lot of women, I had heartburn symptoms, and you're like, oh, okay, what is that? So thank you for that.
Thanks.
So is a heart attack a medical emergency?
It very much is a medical emergency.
Okay.
So in the time that someone's getting to you, your heart's starting to die, it doesn't have oxygen flowing to it. So you want to get help as fast as possible. That's why you want to call 911 and get people there.
Okay. So I actually have two questions now.
Okay.
How and can you prevent a heart attack?
You can.
Okay.
Sometimes it's genetic and you just have, it's bad luck to have that. Other times you need to, follow the healthy lifestyle. It's stuff that is, preached to us day in and day out. Exercise, eat healthy, don't smoke, don't do drugs, limit alcohol, try to keep your weight under control, try to keep your stress under control. If you're diabetic, try to control those numbers. Same with high blood pressure. So main things is following with your doctor. If you do have a huge family history, your dad died of a heart attack at 40, you should be followed by a physician. You should be going and following up regularly to make sure that you don't end up having a heart attack early.
Okay. So everything in moderation and regular doctor's appointments.
Yes.
Okay, good deal. So I hear this a lot, cardiac arrest, and within the nursing field and medical field, and then a lot of people just say heart attack. So is there a difference between a cardiac arrest and then a heart attack?
There is a difference. When we were talking about the pipes earlier in your heart for the heart attack, when those get clogged with something called plaque, it can break open, and then a blood clot forms there and you get your clog in the pipes. When you're talking about cardiac arrest, you're actually talking about the electrical activity that goes across the heart muscle. When that stops, or it's just throwing a tantrum and acting up and doing whatever willy-nilly that it wants, your heart will stop beating regularly. It'll stop doing the beautiful pumping, and that's when you will actually lose a pulse. They pass out. So it is different, and cardiac arrest it's a huge medical emergency because people will die within minutes if you don't get help to them.
Okay, so the two are linked that way. One is kind of like the electrical part and one is the piping part of everything. Am I making
Yes.
that
So
correlation?
if your cardiac muscle is not getting the oxygen from, say, a heart attack, you could have cardiac arrest.
Okay.
But cardiac arrest can be from something else that isn't a heart attack. It could be heart failure, it could be a thickened cardiac muscle. So cardiac arrest can happen from a lot of different things, not just from a heart attack, but it can happen from a heart attack or when you're recovering from a heart attack.
Okay. So what should someone do if they're having a heart attack or a cardiac arrest?
The biggest thing is to call 911. You want emergency services on their way to you. A lot of people are trained in CPR, that type of stuff. That's great, start those things, but you want to have EMS on the way to you. They can kind of prompt you through the phone, talk you through stuff. If you have no medical background and have no idea what to do, they can definitely prompt you to start CPR. They can talk you through it. And then if you do have a defibrillator, you can go grab one of those. Say you're in a business or you have one in the home, you can grab one and use it.
So what would you tell the person that's never been trained in CPR and doesn't know anything about any type of heart attack or cardiac arrest or anything like that?
So a lot of people have at least seen TV shows where CPR was somewhat represented, because obviously they can't crack all the actors' ribs and show it realistically.
Correct.
But one thing you can do is actually just put your hands kind of over the chest and you push hard and fast, and it's the beat of Staying Alive. So you can think of John Travolta dancing around all disco. Sing the song in your head and start pumping away on the chest. Hands-only CPR has been shown to increase survival rates by ×2, even 3 times. So even not doing the mouth-to-mouth portion, if you don't feel like kissing someone that day or you're a little worried because you don't know them, you can still pump on their chest and help keep them alive.
Okay, that's great. Staying alive.
Staying alive.
I like it.
Yeah.
So you did mention a defibrillator. So what is a defibrillator?
So Sun Medical was nice enough to loan us this beautiful defibrillator today.
Okay.
So these can actually be purchased, or a lot of businesses have them. They're out in the community all over. You'll see them in airports, and there'll be a nice sign next to them that says AED. So a defibrillator is a thing that a lot of people see on medical shows, but it's actually represented slightly different, of course, than what's in real life. So in real life, you would put pads on the chest and then yell clear and push a button and it shocks them. So this machine will actually walk you through putting the pads on the chest, helping cut off the clothes, that type of stuff to get to them. It will prompt you if they need to be shocked. It will not shock if they don't need a shock. It will only shock if it's needed. And if they need CPR, it will prompt you to actually start CPR on the person.
Okay, so even if you haven't been trained, this can walk you through it as well.
Yes, and it is clear step-by-step instructions. It is extremely loud, so anybody should be able to hear it.
Okay, good to know.
A lot of these, this is how they're set up now out in the community. In the hospital, obviously, they're different, but it does help to keep people alive.
So let's say you've called 911 now, your loved one's having a heart attack. What can someone expect once they get to the hospital?
So part of why you're calling 911 is that they actually have this beautiful setup in place out in the community and to the hospital. So when you call 911, they will actually come to your home, assess the situation. If they believe it's a heart attack, they're going to take you to a cardiac center, someone that's actually been certified to take care of heart attacks. So they will actually get you in the ambulance, assess you, drive you to the cardiac center, and then have a team waiting. So they will actually meet you in the ER, like at the door, walk with you, like take care of you. And then if you go to a cardiac center, they actually have this process in place that you only have so many minutes to get to, like from one end to the other to get treated.
Correct.
So they will draw your blood, check your cardiac markers, among other things. They will also see and do an EKG, see what that says, and say whether or not you're having a heart attack. Based off of that is what you're going to end up being treated as.
Gotcha. So why is it that some people go to the cardiac cath lab and others just get treated with medication?
So there's actually there's a couple different types of heart attacks. So one that's called a STEMI, it actually has to do with that EKG reading. It has to do with an elevation in a certain portion of it. So one of it, the STEMI, is this huge medical emergency. You are losing cardiac muscle at that time. And you have to be rushed to the cath lab usually, unless you're choosing not to be treated and go a hospice route, say you're 90 years old and you say no. Completely fine, but everybody else is going to the cath lab. So at that time, you go there, they will try to open up that vessel emergently by either balloon, stenting, something that they have in place. Now the other type is, I won't say not a medical emergency because it still is. It's still cardiac muscle, but they can actually use medications to help open up the vessels. A lot of times people hear of nitro. They'll put you on a blood thinner drip, something like heparin, and they will use those medications and then schedule a procedure at a later time. It doesn't have to be quite as emergent and rush you up there. So you have a little more time to prepare and be all set.
So the main draw here today is obviously cardiac arrest and heart attacks. And the take home, the most important thing would be if you feel like you're having any of these symptoms to call 911. Is that correct?
Yes.
Yes. All right. Well, wonderful. Megan, thank you so much for having us today. I feel like now with the holidays upon us, we are all prepared for anything that may come our way. I appreciate you coming. Thank you.
Thank you.
If you guys have any more questions or need any other information, please contact myself or Megan at AmeriCare at 248-288-2270. Thank you again, and everyone have a happy holiday.